Good afternoon, and welcome to this week's episode of Ask Dr. Murphy. I hope everyone is doing well today. My name is Katie Berg. I'm a research study coordinator with the Havey Institute, and I'll be leading today's discussion. I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you this morning or
Hi,
afternoon?
I'm doing great today.
Dr. Robert Murphy is the executive director of the Havey Institute for Global Health and the John Philip Bair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. He answers your COVID, infectious disease, and public health questions each week here on the Havey Institute for Global Health Facebook page. Today, Dr. Murphy will be addressing the latest headlines and our lone US COVID statistic through today, May 2nd. We invite you to submit any questions you have down below in the comments or at any of our social media linked in the description. Starting with the abbreviated COVID statistic. Average COVID deaths per day in the last reported week were 49 daily. The same week in 2024, we saw 90 daily COVID deaths. Dr. Murphy, your reactions to those numbers and the general state of COVID in the US?
Yeah, so the amount of COVID floating around is going down as excuse me, I don't have COVID, but it's going down as predicted. That we're at we're getting into this almost summer season, and we see COVID and flu go way down right now. So this is exactly as predicted. Still 49 people dying a day. But compared to last year, it was 90 per day. So we're seeing this kind of suppression of these infections from year to year. So it's going down. So we'll see how this. Hopefully this will continue even more next year as more and more immunity builds up.
Now, there are no small stories in the infectious disease world right now, but a massive story in particular is that of the measles outbreak here in the United States and all over the globe, frankly. Can you update us on the measles cases? And I'm sure there's a lot of new information coming out now.
Yeah, measles, if you don't get these highly contagious diseases like measles or COVID earlier on, if you don't get them under control right away, then you can't get them under control. And that's what's happened. So we've confirmed now 935 cases in the United States. Texas is the epicenter of this with 683. They've had around 90 hospitalizations, 3 deaths, all the surrounding states, and now many states around the country, including Illinois, where there's at least 2 cases, and 6 of the 10 Canadian provinces, and the Europeans and around the world are also seeing cases of measles now. So what happens is when it gets epidemic like this, everyone that's not immune really gets at higher and higher risk. So it started in a little epicenter where a group of people that don't believe in vaccines and are not political about it or anything, but they got it, and then they spread it to the community. And that community happened to have a large group of people who don't take vaccines. So they got it. And then, of course, they spread it to the neighboring states, and now to everyone travels so much in the United States and the world, really. And they spread it all over the place, including Illinois and Canada and Europe. They got their own issues. But that's really what happened. And then to compound things, local officials in Texas, which is the epicenter, have found that the CDC cuts have caused the cancellations of plans to help Texas public schools with ventilation checks, because this is spread through the air. And also, NIOSH, the National Institute for Occupational Safety and Health, they've stopped doing health hazard evaluations around schools in the world or in buildings and stuff. So it's just, that's not going to help. Illinois, one of the cases actually had the person had passed through O'Hare Airport. How many people got exposed there? Who knows? We'll find out. Illinois, Louisiana, Missouri, Virginia, all reporting their first measles cases. And like I said, in Europe, it's up tenfold in 2024 compared to the year before. And it's just really amazing. They've had in 2024, they had 35,212 cases compared to 3,973 in 2023. So it's just this giant increase. All the deaths so far the 3 deaths have been in the US.
Mhm.
So
I understand there was also a really interesting survey from the Kaiser Family Foundation, less about actual measles infection, but more about information and how people are reacting to the outbreak. Could you share those results with us?
yeah, no, they do great surveys of people, and there's a lot of false claims. The vaccine's causing autism, it's causing measles. I mean, it's just like, it's crazy stuff that's not proven. But luckily, these false claims, which are now all over the place since all the social networks are now completely unregulated, um, less than 5% of people said that false claims believed in the false claims, strongly believed. But a lot of them had, kind of mixed feelings about it. But the hardcore, they don't believe it, or they believe in the false claims is only about 5%. So that's pretty good. And we'll see what happens. But this is all not a good sign, considering that, in 2000, no measles cases in the United States, not one. And now it's out of control, and everybody that's not immune is going to get infected.
Absolutely. And these numbers are not headed in the right direction.
Right.
Unfortunately, the case numbers are still going up week by week.
Right.
Now, a highly respected publication, The Lancet, has just published another paper regarding the consequences of the United States cutting funding for international projects. Specifically, in this case, HIV. Can you tell us the results of what we might be seeing in the next few years?
Well, the United States played a major role in controlling the HIV pandemic with its PEPFAR program. PEPFAR stands for the President's Emergency Plan for AIDS Relief. It was started by George W. Bush, bipartisan support from the beginning, saved over 25 million lives. It's just incredible what that has done. We're just about ready to turn the corner on HIV infections. In other words, the number of new infections keeps going down. People are living longer, and we're just about ready to have actually a higher death rate, overall death rate, compared to the number of new infections. And that would actually start the whole HIV population going ready to extinguish itself. So that would really be great. PEPFAR was just unceremoniously stopped earlier this year with the new administration. And this group in Melbourne, which is published in Lancet, all both highly respected, have done a modeling exercise looking at what the impact is going to be. Now, remember, HIV, it's treated. It's never cured, or very, very rarely. And as soon as you stop the medicine, it comes back. So you get AIDS again, like a second time. It's like diabetes. If you stop taking your insulin, you've got a couple weeks. Most people, it's a few weeks before they die. Because they can't control the glucose and ultimately kill them. There's many examples in the medical world. If you stop your medicine, you're going to die. So this is an unfortunate thing. So the models that they have estimate that somewhere between an additional 4.4 to 10.7 million new HIV infections will occur because of this decrease in the funding by the US. And this will result in 770,000 to approximately 3 million new deaths from this stopping of the funding for the AIDS drugs, which is PEPFAR. So, there's a way to pull yourself back from these kind of programs. I mean, you could have, done it gradually over a year or 2 years and, get other partners in play to take over. But the way this is being done historically is going to really look very, very unfavorably against the American government and the American people. It's a historic. It's at the level of Pol Pot and other crazy people that have had Stalin had this food policies killed millions of people, let alone the people he sent to the gulag. But anyway, if we reinstated PEPFAR right now, that would drop significantly because the damage is already starting to happen. But if we reinstated the support, we would have between 70,000 and 1.7 million new infections and 5,000 to 61,000 deaths. So markedly less than if we don't. So, it's up to Congress and the American people to turn this around and do it the right way. We can pull out, but it has to be done carefully because otherwise we're going to have this total, catastrophe.
Yeah, absolute catastrophe. And speaking of another illness that we can do a lot to prevent and actually cure in this case, which is tuberculosis, surprisingly is having a rise here in the United States with even very recent infections. Can you tell us what's happening there?
Well, TB is now the #1 infectious disease killer in the world. Okay. So we see 8.2 million cases and 1.25 million people dying per year. Now, TB is very different from HIV. TB is curable. You can just give people medicine. They take it for a couple months and you can cure tuberculosis. So, and it doesn't come back after you are cured, unless you get exposed again. But it is really it's just amazing that that it's still around to the extent that it is. And so we've got to keep up with those programs as well. But, the fact that TB still kills this and sickens so many people, it's considered, quote, an outrage when we have the tools to prevent it, detect it, and treat it. So it's just another sad global public health problem that affects 10,000 people in the United States per year, over 10,000, and they're popping up all over the place. Like this last one in Florida in Broward County in a high school, just out of the blue, somebody gets TB. How did that happen? So it's a very contagious disease. It's not like COVID or anything. It's kind of a slow burner, but it's just another thing we have to keep fighting, or it's going to just come back.
Absolutely. And speaking about keeping fighting to avoid things coming back, we talked about this last week, but the whooping cough or pertussis numbers here in the United States continue to rise. Can you update us on that situation?
Yeah, the numbers of whooping cough have just skyrocketed. Last year, in the same time, 2024, there were 3,800 cases, and this year, 8,000. So it's really going up. In the past 6 months, 2 infants have died of it. And more recently in South Dakota, a child died from co-infection with whooping cough and flu, and an Idaho adult died from it. If the trend continues, and it most likely is, the U.S. may be on course for the highest number of infections since vaccinations were introduced in 1948. So it's totally preventable. You have to take vaccines. You have to take multiple doses of it. It doesn't have it's not as easy to vaccinate as measles. Little kids get the TDP vaccine, and older kids and adults get Tdap. You may have heard those terms. The P part is for pertussis, that's whooping cough. It just is another, if people just give up on the vaccines or think that they're causing autism, which, it's been looked at time and time again, never proven. We're going to just keep getting, we're actually going back into the 50s. So, people, if you have relatives that were around in the 50s, there was a lot of this stuff. And that's where we're headed.
It's a very stark difference between the cases that we're seeing now and the cases that we
Yeah.
saw, in between then and now.
Yeah.
So not good news there, but some very good news on the global scale is that the Global Pandemic Treaty has finally made some meaningful progress. Can you share the quick update on that?
Well, this has been going on since the pandemic started. Is what are we going to do in the future? At the beginning of the COVID pandemic, the world was, everybody had their own system, and the communication was very poor, haphazard, chaotic, and we stumbled along and developed a vaccine and tested it within 10 months, and like it was just crazy. We went from 0 tests available per day to 8 million. Amazing progress that was made. So what happens if another pandemic comes? Are we going to make all the same mistakes we did the first time? And so the WHO, 180 some countries in the world, they have agreed on a draft. No, it's not perfect, but at least it's something. It's some place we can start, because there's going to be another pandemic. It's just when and what. And so they've approved a draft, and it is expected to be accepted at the next WHO big meeting, which will happen later this month. And so everybody's on board, including the United States. It's great that we're participating in that and cooperating with others for the next pandemic. So that's good news. That is progress. I'd like to end on a positive note because there's been so many negative things going on lately. But that is a step forward.
Absolutely. And that is very good news and news that we're happy to share with you. We know that we sent lots of comments about that global pandemic treaty. So happy
Yeah,
to share that update. And on that happy note, I'd like to thank you, Dr. Murphy, for your time and expertise this afternoon, breaking down all of the latest data for us and bringing us some good news here.
great. Thank you, Katie.
And thank you all for joining us for this week's episode of the Ask Dr. Murphy series. If you have any questions or comments, please feel free to leave them down below in the comments or at any of our social media linked in the description. Have a great weekend, and we'll see you next week.